Hello guys, in this video we're going to talk about the maxillary canine. So this is the left maxillary canine and this has the single root. So this tooth lies at the third place from the midline and it is present both on maxillary and mandibular arch. So let's start with the chronology. So the first evidence of calcification start at 4 to 5 months and enamel is completed at 6 to 7 years, and this tooth erupt at the age around 11 to 12 years, while the root is completed at 13 to 15 years. So if we take the measurement of this tooth, the crown length is 10 mm. So if we see the crown length from cervical to incisal, it is 10 mm, and the length of the root is 17 mm. So from here to tip of the root, it is 17 mm, and the mesiodistal length at the contact area is 7.5 mm. If we measure the mesiodistal length from here to there, it is 7.5 mm. Also, mesiodistal length of the crown at cervical area is 5.5 mm. So here is the cervical area, and if we measure the length of the crown from here to here, it is 5.5 mm. And the function, so this is the main tooth that helps in piercing and tearing of the food, and it also helps to close mouth, and sometimes as it is frontal tooth, so also helps in aesthetic. And morphology of tooth is essential in developing a prosthesis or in the restoration of the tooth. So this helps in prosthesis development and also helps in restoration, and also it helps in extraction of the tooth. If we know the morphology, then we know the structures and the orientation of this tooth, so it helps in extraction of the tooth. Now let's start with the facial aspect or labial aspect. So this is the facial or labial aspect, and the crown is pyramidal in shape. So if we draw the outline of the crown, it resembles to the pyramid shape. So crown is pyramidal in shape, and mesial half of the crown resemble to the portion of incisor, whereas distal half of the crown resemble to the premolar. So that means the mesial half, here's the mesial half of the crown, this resemble to the central incisor, while distal half of the crown resemble to the premolar. And the mesial contact area lies at the junction of incisor and middle third. So just like in central incisor, if we divide the crown into three equal halves, so this is the cervical third, this is the middle third, and this is the incisor third. So in the mesial side here, the contact area, mesial contact area lies at the junction of incisal and middle third. So this is the junction of incisal and middle third. So the contact area with the other tooth lies in this area, while the distal contact area lies at the middle of middle third. So this is the middle third, right? So in the middle of middle third, the distal contact area is present. So this is the area where it contact with the other tooth, that is premolar. The mesial outline of the crown is convex from cervical to mesial contact area and slightly concave above contact area. That means here we have the mesial outline, and this is slightly convex from the cervical to mesial contact area. So this is the cervical, and here is the mesial contact area where it contact with the other tooth on the mesial side. So this, if you see the outline, this is slightly convex, right? So from here to here it is slightly convex, but above this mesial contact area it is slightly concave. So this seems slightly concave above the mesial contact area on the mesial outline, while on the distal outline of the crown is concave from cervical to the distal contact area. So this is concave from the cervical to the distal contact area. So from here, so distal contact area is here and the cervical area is here. This is slightly concave, like cave depressed structure, and the mesial slope of the cusp is shorter than the distal slope. So here is the mesial slope, so this is the mesial slope of the cusp, this is shorter than the distal slope. So this is the distal slope and this is the mesial slope. So mesial slope is shorter than the distal slope. And also the root is conical shape. So as you can see, it is conical shape and it is singular and it has blunt apex. So here's the apex, so apex is blunt, And also root is curved distally at the apical third. So this is the center of the tooth, and this is the mesial side, and this is the distal side. So you can see the root is curved distally. Now let's see the lingual so this is narrow than the labial surface, so this seems little bit narrow than the labial surface if we compare. And cingulum is large, well developed, and sometimes pointed as small cusp. So this is the cingulum, and this is large and very well developed on the lingual surface. So you can see it is large and well developed, and sometimes it resembles to the small cusp. A well developed lingual ridge is present. So this is the lingual ridge, so this is the elevation part, so this is called lingual ridge. This is well developed on the lingual surface. As you can see, it's the elevation part, so these are called lingual ridge. And deep concavities between lingual ridge and marginal ridge are called mesial and distal lingual fossa. So this is the lingual ridge and this is the marginal ridge, and in between them this is called there is a depression structure. This is called mesial lingual fossa, and similarly on the distal side there is a lingual ridge and marginal ridge, and on between them there's a depression, and this is called distal lingual fossa. And the root is conical in shape and singular, and mesial and distal surface of the root is visible. So now let's see the mesial aspect of the canine tooth. So this resembles to the outline form of the anterior tooth. So on the anterior tooth it resembles to the ways or triangular shape, so it is just like with the anterior tooth. So this is the ways or triangular in shape, and labial outline of the crown is convex at the cingulum. So this is the labial outline of the crown and it is convex, and the lingual outline of the crown is convex at the cingulum, and it is concave at the middle and incisal area. And also root is conical with blunt apex. So if we see the root, it is conical in shape and the apex is blunt. And also mesial surface of root shows shallow developmental grooves. So on the mesial surface somewhere here it shows shallow structure, and this is the mesial developmental groove. While on the distal side this is similar to the on the mesial slide, but it is slightly different. So the cervical line show less curvature. So if we compare with the mesial outline, this cervical line, this show less curvature than on the mesial side. And also it is more concavity above the contact area. So the contact area is around here, and this show more concavity. And the root is conical in shape with blunt apex, and developmental depression is well developed on the distal surface. The developmental depression around here is well developed than on the mesial side. And in the incisal aspect, so this is the incisal aspect. So the shape resembles somehow like this, and the labiolingual dimension is greater than mesiodistal. So the labiolingual, so this length is greater than the mesiodistal length. So labiolingual dimension is greater than mesiodistal length, and the tip of the cusp is labial. So this is the tip of the cusp, this whole thing, and this lies towards the labial side. So in conclusion, this is the single pointed cusp with distal slope longer than the mesial slope, and also it has convex labial outline and bulky palatal cingulum. So cingulum is well developed, and also it has the longest root. And that was it. So if you like the video, then subscribe and feel free to comment your questions.